fellow classmates. My name is Felicia Anderson. My group members are Ashley Hobson and Charity Halstead. We are Group 3. Our topics for discussion is bacterial meningitis and botulism. Bacterial meningitis. I'm going to show you a video of children that have got infected with bacterial meningitis. It is a little graphic, but just keep that in mind when you watch this video.
I'm Michaela. This is my son Jeremiah. Last year my son contracted bacterial meningitis.
I'm Chris. This is my wife Heather and my son Ethan. At 7 months, Ethan contracted meningococcal disease.
It takes away your life, it takes away your limbs, it takes away your,
He lost both arms and both legs, had major facial scarring.
There's no day that this does not affect us. There's not a day that I don't hurt for him, for me.
Despite his disabilities, he is full of life. These disabilities could have been prevented with the vaccine.
If we'd have had a vaccination, if we'd only known, this could have all been prevented.
Learning outcomes. The learner will be able to define and describe bacterial meningitis. The learner will be able to name the signs and symptoms of bacterial meningitis. The learner will be able to describe the causes of bacterial meningitis. The learner will be able to explain the treatment of bacterial meningitis. And the learner will be able to provide precautions of preventing bacterial meningitis. What is bacterial meningitis? Bacterial meningitis involves inflammatory bacterial infection of the meninges, commonly the pia mater and ocular mater, and more rarely the dura mater. Bacterial meningitis is the most common bacterial infection of the nervous system. Infants are at higher risk for bacterial meningitis than people in any other age group. However, people at any other age group are at risk. What are the signs and symptoms? Bacterial meningitis is characterized by an increased number of white blood cells in the cerebrospinal fluid, also known as CSF. Sudden high fever and intense meningeal inflammation, which accounts for most of the signs and symptoms. The swelling of the meninges block normal flow of CSF, causing inflammation. This inflammation produces severe headache, nausea, vomiting, pain, and in many cases, loss of brain function. The loss of brain function leads to conditions of drowsiness, confusion, fearfulness, and irritability. Inflammation of the meninges also puts pressure on the surrounding nerves and muscles, producing stiffness in the neck and affecting sensory input and muscular control. When the actual brain becomes infected, a condition called encephalitis, deafness, blindness, drastic changes in the patient's behavior, coma, or death may result. When it comes to how fast the signs and symptoms may occur, they might develop alarmingly fast or come on progressively. Bacterial meningitis is also typified by a dramatic increase in the number of leukocytes in the CSF. A spinal tap reveals the normally clear CSF is milky in color due to the large number of bacteria and white blood cells. Petechia, small, dark, purplish hemorrhages of blood vessels in the skin are also sometimes present. I have a daughter that died of bacterial meningitis. She was 3 months. Her signs were drowsiness. She wouldn't eat. She would suck her pacifier. She was not using the restroom. She was having trouble breathing. By the time we to get her to the hospital, and they did the diagnosis and tried to give her IV fluids and things like that. They couldn't find a blood vessel to do the IV fluids because they were already relaxed. And when they did test her blood and the results came back, she tested positive for bacterial meningitis. I checked her at like 6 that morning. She was pronounced dead at 1 o'clock that same day. So approximately 6 hours, it took the infection to take over her entire body, which killed her. I also have a baby cousin, that was diagnosed with bacterial meningitis 2 months ago. She's 18 months. Her signs were fever, laziness, dizziness. She wouldn't eat, she wouldn't sleep. By the time my cousin took her to the hospital, her temp was 104 degrees, and they were able to draw blood and give her IV fluids and things. And her blood results came back also positive for bacterial meningitis. They had to do emergency surgery on her, and they gave her a lot of antibiotics and things to cure the bacterial meningitis, and she is alive today. So that's all I have.
What are the causes of bacterial meningitis? Researchers have shown that more than 50 species of bacteria cause meningitis, but the 5 species that cause 90% of the cases of bacterial meningitis are Neisseria meningitis, Streptococcus pneumoniae, Haemophilus influenza, Listeria monocytogenes, and Streptococcus agalactiae. All 5 of these bacteria have virulence factors that allow them to resist phagocytosis and cause disease. How do you get infected? Humans inhale N. meningitis, H. influenza, and S. pneumonia in respiratory droplets from infected individuals who may appear healthy. Babies pick up S. agalactiae during passages through an infected birth canal. Listeria is transmitted in contaminated food, particularly under pasteurized milk, cheese, and meat. In most cases, bacteria spreads into the meninges from infections of the lungs, sinuses, or inner ear via the blood. Head or neck surgery or trauma may also open the passages into subarachnoid space of the meninges. How do the doctors diagnose and treat bacterial meningitis? Quick diagnosis is vital to the patient. Diagnosis of bacterial meningitis is based on symptoms of culturing bacteria from the CSF following a spinal tap. Additionally, serological tests can demonstrate the presence of antibodies against N. meningitis. Physicians treat bacterial meningitis with any numbers of intravenously administered antimicrobial drugs, including all these drugs listed. Quick treatment reduces the mortality to below 15% of cases in bacterial meningitis. How can you prevent bacterial meningitis? Prevention of bacterial meningitis depends on interpreting the transmission of pathogens and their spread in the body. U.S. Centers of Disease Control and Prevention recommends vaccination of children against Streptococcus pneumoniae, Haemophilus influenza type B, and Neisseria meningitis. The CDC also recommends meningococcal vaccination for all military recruits and college freshmen living indoors. Individuals at risk for listeriosis should avoid undercooked vegetables, unpasteurized milk, undercooked meat, and all salt cheeses. Here are some questions about bacterial meningitis. The current first choice of antibiotic for bacterial meningitis is B. cephalosporin. The diagnosis of bacterial meningitis requires a sample of your cerebrospinal fluid. Typical signs and symptoms of meningitis include all of the following except C. red blood cells in the CSF. What bacteria is the leading cause of meningitis in adults?